Today we are doing PDO threads, and PDO stands for polydioxanone. And I've already done one side of our beautiful patient's face, and just so you can see the difference, this side has already been completed, and this side has not. So you can see how much of a lift that these PDO threads can give. So we're gonna do a treatment so we don't leave her half done. So I've already put, I'm gonna have you turn a little, I've already put some lidocaine with epinephrine right up here. Can you feel that?
Yeah.
Perfect. There we go. And there's a whole bunch of different types of PDO threads out there. We use something called Nova thread, and these are Beyond threads, so they're very grippy, which is great. We like grip, we like lift. All right, so you ready?
Mm-hmm.
You're amazing. So that was one. One is in. She's not even using Pro-Nox. I mean, like, look at this woman. She's amazing. Okay. So we are going to go a little bit farther south now. Are you ready?
Mm-hmm.
I know. I know. I love it so much too. Yeah, you did great. I know. So that's the one that's always tends to be the hardest, and okay. But you're a champ, and that one's done now. So we're gonna move on, and I'm gonna have you turn a little, go right here, so you can just do my little pilot channel right there. And we're going to grab another. We're aiming to pull up those jowls. You got this. You're so strong. Good job. That's it. You okay?
Mm-hmm.
Beautiful. Love it. Okay. You know, you're doing great. I just have 3 more. I'm gonna have you turn a little further away from me. This is gonna go along the jawline to pull that up. And these are great because I always call them they're a procedure that keeps proceeding. So we put them in, we reposition her skin, and then they will make her make collagen the entire time that they're in there, which these last, I know you love it, 2 years. Yeah, so good, so easy. She's amazing. No Pro-Nox, can't believe it. But like I said, it will make you make collagen for the entire time that they're in there. So they're dissolved over the course of 2 years. Turn a little away, one more over on this side. You got it, so strong, so proud. A lot of people ask me, like, can I get a facelift, you know, in the future if I have these in? Absolutely. If your plastic surgeon tells you you can't, then I'd find a different plastic surgeon. These dissolve over the course of 2 years. So I would not do these right before a facelift, but you absolutely can do a facelift after you have PDO threads in. Okay, and we're gonna do one more. I'm gonna be turned this way, and we're gonna go in just a slightly different direction. Can you feel here?
No.
Good answer, good answer. Okay. Look, and she's not even bleeding where we're entering, so that's good. I'm using a slightly different thread. It's called an infinity thread for this area. And we're gonna go upty daisy. You got it? That one felt okay?
Mm-hmm.
And we literally can put these everywhere. Anywhere you have laxity in the skin and you want to lift it, PDO threads. Now, once they're in, I can't take them out, so we always like to make sure that they look good. I'm going to pull a little bit. I'm going to use some arnica gel to pull up. And then I'll clip the ends, and then she could be on her way. So there's like no downtime, right? So she can go out, she can go see her best friend that she hates and be like, oh, what happened to your face? It looks beautiful. And you could say, oh, I just started a new skincare cream. Or you can tell her about us, whatever you want. But after PDO threads, I always tell people, like, it's gonna hurt to eat like a big hamburger, open your mouth really wide, even to laugh at my very funny jokes. It will hurt a little bit. If it hurts, stop doing it. I always laugh at my jokes on the inside though, if you have to. But if it hurts, then you stop doing it, right? And then it can be sore for about 3 or 4 days. I mean, you saw what we just did, so it can be sore there. And that's totally normal. The thing I don't want her to do is like do a big mud bath and rub mud on the entry points. Like, don't do that. We don't need that, because those are little open spots that we don't need any extra little organisms getting in. But the threads themselves are antimicrobial, so I have not seen an infection with these threads. I'm knocking on wood there.
Thank you.
Yeah. So that's always good to know. And I like to twist these little guys around. Yeah, but I do love these beyond threads. Now, you've had other ones before. Do these feel grippier, or do they feel the same? They do? Yeah.
They do.
I love that feeling. I did somebody yesterday, and she's like, oh my God, my face feels so tight. I'm like, that's right. Yeah, good. Exactly right. Okay, so we're going to clip these. Smile for me first. Yep. Good. Cute. Okay. I always like to make sure you can't see them when a patient smiles before we cut them, because after we cut them, we can't take them out. And, okay, turn a little away from me. I think I did this right. I know. I keep trying.
It's okay.
Pulling you.
It's okay.
But I love these because then if you twist them, they really pull quite a bit. And I love this one because it kind of pulls everything up. I love them all. We're going to tuck that one behind. We're going to tuck that one. So in her skin, you can see no difference here. You just see a little tiny spot. No big deal. Turn farther away from me so I can just grab. And I want to cut close to her skin without cutting her skin. Of course, I'm not going to cut your skin. Don't be afraid. Although if you're not afraid of me already, then you're not going to be afraid of this.
No, I'm not afraid.
I am not afraid.
Nope.
Yeah. And I'm going to just tuck the ends under, just like that. There you go. Looks super cute. Looks so great. I mean, I have to say myself, I think I did a very good job, which is great. So you never want somebody to go, oh, I didn't really do a good job, so I guess I better never say that. But tolerable.
Oh, yes.
Yeah, and that took us, what, like a whole 10 minutes?
Yes.
And now she can go out, nobody knows that she did anything, she doesn't have any downtime. You could get bruising, you know, because we're putting, you know, little needles in, and they're actually blunt tip. So if you wanted to see, I don't know if I should show you, but they're blunt tip cannulas that the thread is on. So as we glide through your skin, you can feel a little pushing in your skin. It's irritating the cells that make collagen, so you're making collagen just by using these cannulas, and then the thread is inside, and then we just pull out and the thread stays in. So if this hits a vessel, it's going to push the vessel aside because it can't pierce a vessel. You can't, like, I'm trying to poke myself and I'm not bleeding. It's not even going through my glove. So you don't really typically bruise. Some people have, but typically not. And you're not going to bruise. You're just going to look amazing. Mm-hmm. So if you want to find out more about PDO threads or about any of the number of procedures that we do, you can find us on Facebook, Instagram, YouTube, and online at our website at RejuvenationMD.com.